talk about soft tissue balancing, so we know that the medial soft tissues are tight and lateral soft tissues are relaxed. So what you need to do is you need to do a release of the medial soft tissue. So it is basically lengthening either in the form of VY or Z plasty or Z plasty for the medial capsule. Now, you have to do a lateral intermetatarsal release because there would be a lot of scarring and fibrosis along that area because of the previous surgery. And that is so that because that scarring itself actually also prevents the first metatarsal to move medially. So for that, you need to do a lateral intermetatarsal release. And then followed by that, you do a tendon transfer or ligament repair. This is for the surgery, soft tissue surgery in soft tissue imbalance for a flexible deformity. So, what are the various tendon transfer which are available for hallux varus? It is broadly divided into two types. The first one is a dynamic transfer, in which a dynamic transfer is where the muscle body is attached. So, whenever the muscle is contracting, it is causing the valgus pull for the big toe. The problem with that is because the muscles are so small over this area, so the tensioning, how much to adjust is very difficult as it is very dynamic. And long term, as the muscle tension loses, or if the muscle tension loses, then the failure rate is relatively is expected. The other option is a static transfer, in which you are using a muscle, but you are actually detaching the muscle body. So it is more of a static. It is just like a ligamentoplasty. The tension adjustment is more simpler in these cases. And then you can either use artificial substances also, and it is long term, it is more stable.